think it's a really under-researched and underserved topic. And in general, we see that a lot of our patients who are boys and men get referred much later than girls and women, and sometimes struggle more because there's really limited guidance and research in the area.
So the next question that we have are, so what are some policies or action items that listeners can implement and begin to do to start eliminating the disparities and inequities when it comes to mental health treatment and eating disorder prevention?
Have there been any recent developments in the research of treatment for eating disorders? Especially, have there been any targeted approaches to help people based on their background, their race, their socioeconomic status, and their gender?
Okay, so let's first start off with some introductions. So hi, everyone who's watching and whoever is listening. My name is Kelsey Wu. I'm currently a junior in high school, and as well as the founder and CEO of 4U. 4U is a nonprofit youth organization that is whose mission is to empower youth of all genders, races, and sexualities to develop loving, positive, and courageous mindsets about themselves and their bodies. And I'm going to pass this on to Fiona.
Hi, everyone. My name is Fiona. I am the president and also mental health project leader of the Front Page Initiative. We are currently collaborating with EVOLVERE Mental Health, which is an online mental health platform that's mission is to get advocates, students, and professors together to hopefully create a cohesive space to equip students with proper tools to take care of their mental health. I'm very honored to be here. Thank you for inviting me.
And Jason, if you could introduce yourself.
Sure. Hi, everyone. My name is Dr. Jason Nagata. I am a pediatrician and researcher specializing in adolescent and young adult medicine at the University of California, San Francisco. And my specific area of research interest is in boys and men with eating disorders.
So this specific project that we're doing is part of our big awareness week called Blue Week. And Blue Week is an entire week where multiple youth organizations such as 4U, EVOLVERE Mental Health, the Front Page Initiative, the Shunya Project, many youth organizations are banding together to raise awareness about boys and men. And a part of this initiative is we're going to be conducting interviews of various men who are mental health advocates as well as specialists in this field, such as Dr. Jason Nagata. So the first question that we really want to start this interview off is by really asking you, Dr. Nagata, about the recent findings you have done or you have had in eating disorders and mental health in men.
Yeah, thank you so much for having me and for raising awareness about eating disorders in boys and men. I think it's a really under-researched and underserved topic. And in general, we see that a lot of our patients who are boys and men get referred much later than girls and women, and sometimes struggle more because there's really limited guidance and research in the area. So I think this is a great opportunity to raise awareness and to have an open discussion. So to your question about recent findings, I do think that eating disorders in boys and men we found actually present differently than in girls and women. Often the sort of idealized masculine body image for boys and men is to get really ripped and muscular and big, whereas often the idealized body image for girls and women is to be thin, which leads to weight loss behaviors. And so some of our research has actually looked at some of the behaviors that boys and men with eating disorders engage in. And oftentimes it's actually a lot more on excessive or compulsive exercise, and also using performance or appearance enhancing drugs and supplements like anabolic steroids or creatine or growth hormone or other or like high protein shakes or powders to try to bulk up and get more muscular. And so sometimes these behaviors are missed as eating disorder behaviors because they're not typically what what people think of as eating disorders. But a lot of the boys and men with eating disorders can still have really significant mental health issues, fear of fat, and a real preoccupation with the way that they look in a way that really worsens their quality of life.
Awesome. Thank you, Dr. Nagata. Regarding your topic about how mental health and eating disorders are different in presentation between young men and young women, why do you think it is that young women are given so much more mainstream media control when talking about eating disorders? And why is it that there is such a disparity between young women and young men?
Yeah, I do think that that's a really important question too. And I think that historically, a vast majority of the research on eating disorders has been conducted in girls and women. And so a lot of even the treatment guidelines and diagnostic criteria are mostly based on female samples. And actually, up until this point, like not over 99% of research on eating disorders has focused mostly on women and girls, and very little has focused on boys and men. So I think that there's a bias not only in the media, but in medical care and mental health care, because there's just been so much historical research and studies on eating disorders in girls. And one example of this is that actually in previous versions of like the Diagnostic and Statistical Manual, which is one of the guidelines for diagnosing eating disorders, some of the previous criteria, for instance, to have anorexia nervosa, required that a patient have amenorrhea, which means they miss their periods over a period of time. But obviously, boys don't have periods, so that criteria doesn't apply to them. And actually, even today, some of the medical guidelines for treating adolescents with eating disorders still use loss of periods as a criteria for medical management. And so that obviously doesn't apply to boys either. And even in a lot of the current clinical practice guidelines, there's no real mention or specificity for boys and men, even though they have kind of unique considerations and presentations. So I think that the focus on females and girls and women is not only in the media and awareness, but also in the medical and psychological fields as well.
That is incredibly interesting because Fiona and I actually just got off a call from like a male advocate who uses his social media platform to raise awareness about eating disorders in boys and men. And he talked a lot about how he experienced in his community, like there's such a biasness towards mental health treatment and eating disorders in boys, in girls. Like it's just so much centered towards girls, but we're also seeing it not just in the media, but in science and in medical research and studies, which is so eye-opening to see that it's leaked from, I don't know, maybe it was from society impacted medical-based research, or is it medical-based research that impacted society? But it's just, it's so interesting to see and really eye-opening and honestly a little bit scary as well that we're seeing like this kind of mirrorized version of society in medical treatment.
Yeah, and I think that not only in those diagnostic criteria, but to add on to the first point that I was mentioning about some of the recent research, a lot of the screening tools and questions that we typically associate with eating disorders, like disordered eating behaviors such as skipping meals or fasting, using laxatives or diuretics or vomiting to lose weight. Those are mostly behaviors with the goal of losing weight. But as I mentioned, a lot of guys with eating disorders aren't actually trying to lose weight, so they may not engage in any of those behaviors, which are commonly thought of as disordered eating behaviors. You know, they may be using performance-enhancing drugs or supplements. They may be actually over-consuming protein, trying to get large and muscular. And so a lot of those questions that we even ask and even the behaviors that we think of as eating disorders are somewhat biased. And I think another thing, even the name eating disorders, one thing that's not really recognized in that is that you can have big energy deficits just by excessive exercise. So even if you're eating, a quote unquote normal amount for someone, your size, if you're exercising a lot, you can still have energy deficits and be in a state of malnutrition that can still have the same physical health effects of restrictive eating, because you still have the same types of energy imbalance. And I think exercise is something that, males with eating disorders present with more often. And that's also kind of under recognized in the eating disorder field.
Yeah, with abusion of exercise and restricted eating and that stuff, it's if for majority of this society, they don't know what those things are, and it kind of goes back to how eating disorders are kind of like everyone just thinks, oh, there's only one eating disorder and it's anorexia nervosa, but it's so much, and it's so complicated of a field because it goes back to how everyone is not the same, people are not the same, but we all interpret the beauty standards. We all have the same beauty standards, and we all try to implement it, even though majority of it, or like 98% of society, doesn't have the genetics to conform to what the 2% of people have, which are the body ideals. So the next question that we have are, so what are some policies or action items that listeners can implement and begin to do to start eliminating the disparities and inequities when it comes to mental health treatment and eating disorder prevention?
Yeah, that's a really great question. I think one thing to start with, as we've alluded to earlier, is first to sort of get rid of stereotypes and recognize that eating disorders can really affect people of all genders, all sexual orientations, all races, all ethnicities, all sizes, and all socioeconomic backgrounds. I think that there's a perception that eating disorders mostly affect thin, wealthy, white, Caucasian females, but in fact, they can affect boys and men, they can affect sexual minorities and people of all races. And I think one other aspect that is under-recognized is I think most people think that people with eating disorders are all thin, but in fact, people of all sizes can be affected by eating disorders. And there's actually research to show that those who have who are of larger body sizes or larger body weights, because of just what you were saying, this sort of pressure to conform to a certain body ideal, that people with larger bodies actually may have more pressures to engage in disordered eating behaviors, actually engage in them in higher rates than people of quote unquote normal or thin sizes. And so I think the first thing to realize is just that you can't tell if someone has an eating disorder just by looking at them or by certain demographic characteristics, because eating disorders really don't discriminate, and they can affect all types of people. So I think that that's one action that all people can do if there is a friend or a family member, or for teachers or doctors or healthcare providers, to really not get stuck in those stereotypes, and to realize that if somebody's having sort of warning signs, or is becoming really obsessed with their weight, food, appearance in a way that is worsening their quality of life, to really encourage them to get help, or to help them to get help, or refer them to a professional. Because I think a lot of times, because of these stereotypes, certain populations, particularly boys and men, do go unrecognized for longer periods of time. And so by the time they do get help, they're often more sick, more medically compromised, and may have worse mental health outcomes at that point. So I think that just for the everyday listener to realize that eating disorders can really affect a diverse range of people. So I think that that's one thing that individuals can take on. But I think, as you mentioned, in terms of like policy or action items, I do think that in general, right now, and I know that we'll talk about the rise of eating disorders recently, especially during the pandemic, I think there really is not enough mental health funding or even providers or a pipeline of providers to help. And so I think that getting into treatment can be challenging, especially during the pandemic when some support options are closed due to social distancing. So I think that just additional funding as part of pandemic relief could certainly help with additional services for people experiencing eating disorders.
Yeah, definitely. Thank you so much. So you have a book centered around eating disorders in boys and men. Could you talk a little bit about that? Maybe elaborate on some details of the book.
Yeah, thanks so much for highlighting the book. So because of the lack of research on this topic of eating disorders in boys and men, I was fortunate to work with a few colleagues from different disciplines, psychology and nutrition and medicine and others on really a clinical handbook that's meant to help providers and clinicians to help care for boys and men with eating disorders, just given that so much of the research is focused on women and men and women and girls, and especially because there's really limited guidance that's specific to boys and men. So the book has several sections. One is on medical management, one is on more of the psychological and mental health aspects, one is on prevention and treatment, and then the last section is on sort of diverse populations and cultural and social issues related to boys and men and body image. So it was a really great opportunity to work with some of the leaders in the field. A lot of different authors and collaborators contributed different book chapters. And it's really meant to be a guide for doctors and other clinicians in helping to manage eating disorders in boys and men. And I would say that even though it's a good first step, and the book just came out this past April, there's still so much gaps in the medical research and general research for eating disorders in boys and men. So I hope it's just one step towards getting more awareness and clinical practice guidance for eating disorders in boys and men.
Just kind of a little bit of a follow-up question with the book. Have you, for the authors and various authors that have created it, it's meant to kind of educate the next upcoming, maybe like upcoming doctors or people who are intending to go into pediatrics. Have you guys thought of probably like giving the book to universities, or having maybe like it sort of be sort of like maybe a supplemental material that can be taught to people who want to go into the pediatrics field?
Yeah. So even though I'm a pediatrician, the book is broad enough that it includes all aspects of eating disorder treatment, including nutritional management for like dietitians, and also mental health, for psychologists and social workers and psychiatrists. And so it actually is meant to be broad interdisciplinary guidance. And it is actually published by an academic publisher. And so it is available as a textbook for courses and at universities or schools to help inform the topic.
That's great. Thank you. So the next question that we have is, so how can listeners who are hearing right now best help and support someone who has been diagnosed with an eating disorder?
Yeah, I think that, support is such an important part of recovery in eating disorder care. And so I think that, especially for teenagers, the Standard of care is called family-based treatment. So that involves, support from parents and even siblings or other family members or friends to, help make sure that the young person is on track with getting their nutrition and keeping up with, the recovery. And it's definitely a long road and is different for different people and can have some ups and downs for sure. And so I think that just keeping an open mind, not having certain stereotypes, like we were talking about before, understanding that eating disorders, you can't necessarily tell just by looking at someone, how they're doing psychologically or mentally. And so even if somebody looks fine or they don't look skinny or they don't fit certain stereotypes, they can still be struggling a lot. And so to not make assumptions about that as somebody is entering treatment. So I think the first step in terms of prevention is if you do know of a loved one who or a friend who you're concerned about, to let them know that you're concerned and maybe to try to help them to get help. But if they are already in treatment and going through the process, it can be very challenging. And just having the support of people through recovery, either to distract them from some of the lows and or just to help make sure that they're on their treatment plan, getting in enough nutrition or doing things that are going to be beneficial to their health and not, trying to distract from some of the more disordered eating behaviors or cognitions can be helpful.
Definitely. Thank you so much. Going back to more of a research and data standpoint, have there been any recent developments in the research of treatment for eating disorders? Especially, have there been any targeted approaches to help people based on their background, their race, their socioeconomic status, and their gender?
Yeah, that's a really great question. And that is definitely the focus of my research agenda. So as I mentioned, the book was sort of a first step, but my goal for the next few years is really to try to do targeted research on treatment of eating disorders, and specifically, since I'm a pediatrician, like the medical management of eating disorders in boys and men, and to really understand what differences there are by sex or gender, and to make sure that we're individualizing care as best as possible for boys and men. As I mentioned, some of the medical guidelines currently say, like if you don't have a period for 6 months, then you need to do additional testing for like bone density, but that obviously doesn't apply to boys and men. And I'll just mention our most recent study that we've worked on, which is actually looking at nutritional management for adolescent boys and young men with eating disorders who have to be hospitalized. And we're actually finding that in general, boys actually have higher energy requirements than girls of the same age. This could be due to metabolism and physical activity factors. But right now, most hospital nutrition protocols actually treat boys and girls the same way, regardless of their gender or sex or even size. And so if somebody needs to be hospitalized for an eating disorder and have nutritional refeeding, often they're sort of started at the same amount of calories from the beginning, and then they advance gradually each day until they sort of get to their target calories and they're medically stabilized. But one study that we actually looked at found that the boys who need to be hospitalized actually have much higher nutritional goals in the end than girls. And because everyone starts at the same level, it actually takes boys much longer to get to that goal, and they end up having to be hospitalized for longer. And so one approach that we're considering advocating for, again, we have to make sure that the study is done robustly, would be potentially to start boys at maybe a higher initial calorie prescription if appropriate, so that they don't have to have longer hospitalizations than girls and have poorer outcomes.
Yeah, individualized. I think it's really great that there's been more research and more initiatives towards individualizing medical treatment. I mean, I know that at least to us, or maybe to the listeners who are listening, this kind of all sounds like common sense. Like, of course, medical treatment should be individualized. Eating disorder treatment should be individualized. But I know that when these policies were made, maybe it was at a time where maybe eating disorders and eating disorder research and prevention and stuff was not as advanced or as new as it is today. And it just goes to show that we just need to keep on updating these policies to reflect the growing, the new population, the new era, or the new reality that is the present. So the last question that we have here is really kind of emphasizing on the state of where we are today, and just like where we are now, which is in the middle of a pandemic. So there hasn't really been much news coverage, but there has been some reports of heightened eating disorders and worsened mental health, not just among youth, but just among the general population. As a pediatrician working in the eating disorder wing in the hospital, what is your personal experience on the eating disorder epidemic? Has it worsened? And have specifically, like, what effects have you seen the pandemic have on boys' mental health and eating disorders?
Yeah, I think that, thank you for asking this question and for raising awareness of it. One of the real heartbreaking aspects of the consequences of the pandemic are that we've really seen that adolescents and young people have struggled a lot with social isolation, and cancellation of schools or activities. And this has really led to a huge rise in eating disorder referrals and hospitalizations. I mentioned that I work at the University of California, San Francisco, in the San Francisco Bay Area, and our hospital has seen more than a doubling of adolescents and young adults who've needed to be hospitalized for eating disorders since the start of the pandemic. And these trends are pretty much similar across the country. And actually, the National Eating Disorders Association has similarly reported a 78% increase in people calling or messaging their eating disorder helpline during the pandemic. So this is a pretty universal experience, both in the Bay Area, in the US, and even internationally. I think that there are a lot of factors that have led to this increase in eating disorders. I think primarily, being isolated socially, because teenagers in general are very social and influenced by their peers. There's just been a lot of anxiety in general about the pandemic, whether it's job loss or not being able to go to school, and economic issues if people have experienced, are seeing that their families or their parents are struggling. I also think that there's been major disruptions in normal routines like sports. And as we mentioned, one of the ways that eating disorders can present differently in boys than in girls are often we do have a lot of male athletes who have, and they are at higher risk. And so athletes who maybe aren't able to go to the gym or train or exercise during the pandemic because of closures have really been struggling. And so some of them have either compensated by really restricting their food intake and eating less. And some of them have sort of resorted to really excessive exercise on their own. So we have a lot of patients who, for instance, will just run, for several hours a day after every meal or snack, or will hide in their room and do sit-ups, throughout the night. And so I think that our athlete population has definitely seen a toll. And I also was mentioning that there has been more of a focus potentially on body image, with just the increase in video conferencing like Zoom, or the use of social media to keep connected with peers if you're not able to see them in person. And this sort of increase in focus on body image or cameras and photos can also trigger body image issues for girls and boys. And I will say that more and more there has been more of a presence of boys on social media like Instagram, TikTok, and other platforms, showing off their bodies or these idealized body image, whether it's really muscular and lean, more so than we've really seen before in prior years and decades. So I do think that some of the unique aspects that have really affected boys and men during the pandemic have been among athletes and also with social media.
I did say last time this question that that it was the last one, but actually I want this one to be the last one because I really do think that while the eating disorder epidemic is a sad one, and as you said, this increase has been heartbreaking, we definitely want to end things on a positive note because while things are tough, that doesn't mean that they have to get worse. And that's the reason why we're doing this awareness week. That's the reason why we're all here to talk, is we want to make things better. So, Dr. Jason Nagata, what would you tell the listeners, especially the male listeners who are here right now? What would you say to them if they are going through an eating disorder or they are having a hard time, feeling good in their bodies? What would you say to them?
Yeah, I think that I would say that first of all, you're not alone. Even though eating disorders can be stigmatized and people may have stereotypes, actually eating disorders are quite common in boys and men. They're just under-recognized. And so I think that the important first step is if you are feeling like you're struggling with body image or weight or appearance and have any concerns, to not go through it alone, but to try to get help, talk to your parents or a trusted teacher or friends, or even your pediatrician or doctor to, take the first steps towards getting help, because I think it's really hard to go through some of these struggles alone, and getting professional help can really make a difference in terms of both your physical health and your mental health. So I would say, definitely reach out. Also, as I mentioned, the National Eating Disorders Association also has actually a hotline or a helpline that you can call or message to get some advice anonymously. So that's also a good resource to start to talk to someone and take the first steps towards getting help. And I will say that one of the biggest rewards as a physician and a doctor is to see our patients recover and do well. And actually this past week, I was on NPR talking about the influence of the pandemic on eating disorders in adolescents. And we were able to bring in one of my former patients who, has had a road to recovery, but is now in medical school, and was able to talk about her experience as both a patient, but then also now as a provider. And I do think that, these experiences, while they can be really challenging, can also, have people experience like a new found appreciation for life, and actually, that can be translated into a future career of like helping others and helping those who are also struggling with this and advocating for this. So I think that has been a big reward for me, to see people who've been able to get better and thrive and pay it forward.